The English Nurse by Professor Charles Lane Olmsted, Chapter 8, ER, a Gimcheon University presentation. Vocabulary: debridement, debridement. Ambulatory, ambulatory. Trauma center, trauma center. Tox screen, tox screen. Defibrillation, defibrillation. Stat, stat. Aspirate, aspirate. Arrhythmia, arrhythmia. Angioplasty, angioplasty. Spinal tap, spinal tap. Catheter, catheter. Endoscope, endoscope. Epidural, epidural. Gastric lavage, gastric lavage. Hyperglycemia, hyperglycemia. Hypercalcemia, hypercalcemia. Paresis, paresis. Sepsis, sepsis. Subdural, subdural. Tachycardia, tachycardia. Shock, shock. Hemoglobin, hemoglobin. Triage, triage. Hypoxia, hypoxia. Endotracheal tube, endotracheal tube. Deep vein thrombosis, deep vein thrombosis. Type and cross-match, type and cross-match. Anaphylactic shock, anaphylactic shock. Ambulance, ambulance. Wheelchair, wheelchair. Stretcher, stretcher. Sentence patterns. The words in parentheses are interchangeable. I need help with the catheter in room 1. I need help with the spinal tap in room 1. I need help with the gastric lavage in room 1. I need help with the debridement in room 1. We need a wheelchair in room 2. We need a stretcher in room 2. We need a type and cross-match in room 2. Tell OR we are sending them a man suffering from paresis. Tell OR we are sending them a man suffering from sepsis. Tell OR we are sending them a man suffering from deep vein thrombosis. 4. We need a tox screen in room 3. We need an endotracheal tube in room 3. We need an endoscope in room 3. Prefixes, suffixes, and abbreviations. CPR, cardiopulmonary resuscitation, is basic emergency procedure for life support consisting of artificial respiration and manual external massage of the heart. DOA, dead on arrival. Declare dead immediately upon arrival at hospital. ECG or EKG, electrocardiogram. This monitors the heart. GSW, gunshot wound. Penetrating injury from bullet shot from a gun. STD, sexually transmitted disease. Disease caused by infection through unprotected sexual contact. And sept or septo, infection. Septicemia, blood poisoning. Sentences. All stretchers are in use because we have 5 ambulances full of patients from a bus crash. The patient is ambulatory, but I still worry about his ability to walk. He skidded on a gravel road with his motorcycle, so he needs a debridement. He is going up for surgery, so he will need a catheter put in. The person in trauma 1 ingested pills before she came in, so we will do a gastric lavage on her. The person in trauma 2 took different pills, so we need a tox screen before we know what to do. Miss Kim wants an epidural when she delivers this baby. He's going into shock. We need more blood in him. Stat. Just lay still for the spinal tap. There will be a little poke with a needle. Don't move. Put him in a wheelchair and take him to radiology. The endoscope shows he has gastritis and 2 polyps in his colon. 2 school buses crashed, so we need to set up a triage to treat the patients. There are so many accidents and emergencies, the hospital started a separate trauma center. Trauma 1 patient has tachycardia, so try massaging his carotid artery, but keep the digitalis handy. Whatever cut you on the leg got infected and turned into cellulitis, but fortunately antibiotics cured it. The sepsis went untreated and turned into septic shock, which killed him. My wife is pregnant and her hemoglobin is low, so we are eating more iron-rich foods. Overactive parathyroid glands produce too much calcium, causing hypercalcemia, weakening the bones. They used the defibrillation to reset his heart because he had arrhythmia from the car wreck. I ate too much cake on the cruise and developed hyperglycemia, causing me to vomit. They are looking for a kidney donor, so they type and cross-match the family. Your father fell and hit his head. We will run a CT scan to see if he has a subdural hematoma. He swallowed his tongue. You need to insert an endotracheal tube now. Quick, get him on oxygen. He's going into anaphylactic shock. Hurry and aspirate him before he chokes on his own vomit. He was tackled and caused some paresis, but he is improving. He needs angioplasty to improve his blood flow or he will lose the leg. You are suffering from DVT, deep vein thrombosis, and we need to start dissolving the clots right away. He has enough oxygen now, but the hypoxia affected his brain. Conversation A between nurse Mrs. Lee and the son. Hello, Mrs. Lee. This is Sandra, a nurse at the city hospital. Your son John was in an accident, but he is okay. We are calling to get your permission to treat him. What happened to him? He was on his way to school. From what he told us, a car hit him and knocked him to the ground. The man brought him to the hospital. Why didn't he call? Can I talk to him? He said he lost his phone. He needs stitches and he said his arm hurts. We will x-ray. Here he is. What happened to you? How did he hit you? I was late crossing the street. The car knocked my phone into the drainage. You weren't paying attention to the traffic. Weren't you with some friends? Yes, but they had already crossed and I was still on your phone. Let me talk to the nurse. Hello. Like I said, he needs some stitches and we'll x-ray his arm, but it doesn't seem broken. Has he had a tetanus shot in the last 5 years? No, so give him that and whatever else you need to do. I will be there in about 15 minutes. Questions. Does it sound like it is a serious accident? Does it sound like the car was going fast? In what way could it have been more serious? Have you ever seen a person hit by a car? How serious was it? Why would the nurse call the mother? Conversation B. That was the police about a school bus accident on the highway. There are about 25 kids coming in. Some broken bones and lots of cuts, but nothing life-threatening. The less serious ones we can combine in rooms 1 and 2. Leave 3 through 6 for more serious. I will call the other floors and get some orderlies to help with patient info and vital signs. We should get someone from the administration office to handle all the phone calls and parents. Good idea. Have the orderlies with you near the door and do triage as they come in. Get Mr. James to his room now. He has been x-rayed and has a room. Tell him we will be swamped soon. Tell X-ray to send the film to the floor. I will get some more suture kits on the way back. The 2 doctors on call and the orthopedic doctor will be here in 10 minutes. I'm calling Byung and Song back from lunch. No need, they're here. I'll take Mr. James to his room now. Let's check the rooms now and make sure we have enough equipment and supplies and that everything is clean. Make sure we have enough wheelchairs and stretchers. I'll call X-ray and tell them they may be busy. What do you think a suture kit is? What is triage? Why would you do that at the door? Why would they have someone from administration handling phone calls? Discussion. What do you think that situation will be like? Do you think you would be excited or nervous? What are some other situations that may need triage? How would those be different than this bus accident? More conversations. Have a conversation on one of those situations. Reading. Life and death situation. The emergency room is usually the most exciting place in a hospital. You never know what will come through that door. The patient could be there because of an accident, an illness that got too much to bear, a murder or suicide attempt, a child who became sick during the night, or a sudden medical condition that makes it a life and death situation, such as a massive heart attack or debilitating stroke. The patient may be there a short time as the person is deemed critical enough to require immediate surgery, or maybe the child just needed some stitches for a deep cut on his foot, or maybe the person never had a chance as he was DOA, dead on arrival, or maybe he is alive but in such bad shape with the DNR order, do not resuscitate, that he is made comfortable while waiting for family to say goodbye. The emergency room has a big well-lit sign, which attracts plenty of attention, so people will head there as a hospital entrance, such as the anxious father-to-be bringing his wife who is going into labor. The staff will quickly take the couple to their intended destination. The nursing staff is there to assess the situation, treat the patient, and assist the doctor. Most emergency rooms have a doctor, nurses, and orderlies. They are all important elements in the care and well-being of the patients. Time is critical, so is a job where people need to be on their toes. There can be lots of blood and guts, so it is not for the person who faints or gets queasy. Emergency rooms are open 24 hours a day, every day of the year. There are no holidays there. 4 in the morning on the coldest day of the year can be just as busy as 4 in the afternoon on the hottest day of the year. There is no predicting, no trends. Because they may have to deal with a large number of situations, there is always many different pieces of equipment, such as crutches, oxygen, and suture kits, and supplies such as bandages, gauze, and different medicine. You will see people at their best and at their worst. You will see the side, both literally and figuratively, of people seldom seen by others. You may be healer 1 minute and counselor the next, then policeman a few minutes later. It may be a slow day, but then the closer you get to quitting time, the busier you get, and you find yourself leaving 3 hours later. There is seldom a dull moment. Questions. What are 2 of the duties of the nurse? What does DOA mean? What does DNR mean? Name 3 medical conditions that would probably require a trip to the ER. Discussion. Have you ever had to go to the ER? How was it? Describe it.